Can you guys hear me?
Yep.
Mhm.
All right, Dora, I am going to get started now. So if
Okay.
you want to open your presentation. Hi, everyone. I hope everyone's having a great evening. I just impromptu started the broadcast real quick, so we're all just sitting here hanging out waiting for everyone to start, but it's okay. It's after 5 now anyways. So I hope you're having a great evening. Those of you that know me, hello. Those of you that don't know me, I am Molly. I'm the Executive Director here at the RAL National Association. I'm here with Dora Valentin and Dave. I'm not sure how to say your last name, so I'm not going to butcher it. But I'm here with Dora and Dave, and they're here with Docuwizz. They're going to talk to you about managing higher risk residents and Docuwizz in general, I'm sure. So Dora has a long experience with us. She's been to quite a few of our conventions. She's been working with us for quite some time now, and she has a care home herself. So I can tell you right now that this is firsthand experience, somebody who knows exactly what they're doing and has a wonderful product and knows you guys inside and out. So if you guys have questions, over on the right-hand side, there's a questions drop down. You can type your questions in there at any point in time during the presentation. She's not going to answer them until the end of the presentation if you have questions directly for her or Dave. If you have questions about audio or your visuals or something else that comes up, go ahead and type those in there and I'll try and help you as best I can. Otherwise, I'm going to hand things off over to Dora and she can get things started. So thank you for being with us, Dora.
Thank you, Molly. That's we're very excited to be here with you guys today with Residential Assisted Living National Association, and I am excited to be part of the organization and to be coming to the convention this fall virtually and been to the last two in Arizona. So thank you guys. Thanks for having me. I will introduce David a little bit. He's actually with Sierra Professional Insurance Services, and he's been in this industry also for decades, and he'll explain all that himself. But Dave has been my agent for a long time, and we've gone through some claims together, and so I truly trust him, and he's a wonderful professional as well. So thank you for being here with me, Dave, today.
You bet.
Yeah, so our presentation together is managing higher risk residents, in the residential care setting. And of course, that's kind of what that means is we're going to talk about risk management. And risk management kind of scares people. It's kind of boring. It's not a fun topic. So, it's 5 o'clock, at least in the Pacific. So I guess right afterwards, you can definitely have a shot or pretend it's happy hour and just forget about all the risks, right? But it's really important that we talk about the good, the bad, and the risk. Just a real quick introduction of me first, because you're probably starting to hear my accent, is that I'm Hungarian. So I was born and raised in Hungary, but I came here when I was quite young. So I went to school in the US. So that's where the accent comes from. So now you no longer have to listen to that. So our session, we want to tell you about how to, what kind of lawsuit exposure you might have when it comes to high-risk residents. And then we want to talk about how do you improve your defensibility by doing better job at documenting. And the reason I'm here is because I developed a program called Docuwizz, which is a software to help you document in your homes. And so we'll talk a little bit about that as well. So we hope to give you some exposure to the activities that could be disruptive to your business, help you understand practical tools to use with your caregivers, and hopefully you'll learn to reduce costs in exposure to these operations. So as far as the outline today is, I'm going to cover some introductions, the 5 pillars of risk management. Then Dave will talk about high-risk residents. I'll talk about documentation, and then we'll close looking at the future together. So my little background is that I'm an administrator, and like Molly said, I still own a home and still work for other homes as an administrator in the state of Nevada. And I have been doing this for about 5 years. And before that, I was working in residential settings, but for a different population. And although that was in the residential housing officers, I had been dealing with 24/7 supervision and human and facilities issues and emergency response and ongoing training, and of course, ongoing documentation for many, many years. So obviously in my previous life, we would document a college student who got drunk and ran around naked. And in the residential assisted living world, we would document an elderly who forgot his pants, hang it on the walker, and now he's walking around naked, right? So a little different scenario, but same thing. We still have to document in very interestingly similarly ways. Okay, so here are some of the incidents that I've dealt with in my time. Obviously, there's lots of falls we deal with. We have bed sores, violent behaviors. I'm sure many of you have memory care facilities, but I certainly have had Alzheimer's licensed homes, and so that becomes an issue. But also dealing with the families, you know, how they approach their loved one, or, you know, well, less loved, but definitely a family member. Roommate conflicts, and I've even had a major flood that I'm going to talk to you about. So if you guys have your homes, you probably have the TV on, and then every 20 minutes or so, you hear a little jingle, something like, trip and fall, we do it all. So that's kind of how we wanted to kind of bring up the lawsuit situation. There's a lot of attorneys that are encouraging our clients and their families to look at slip and falls and, you know, wrongful death and all kinds of lawsuits. So, and there's investigations and things. And so we don't really have a good rep as an industry, I would say. There's a lot of sort of neglect and abuse, and there's posters about making sure that people report abuse, and there's scary statistics about abuse. And I think that our industry and our long-term care type is probably the best. You know, the people come directly to their owners and have only, you know, 10 to 15, 6 to 15 residents per home. I mean, it's very, the chances are of these negative things to happen are much less, but we get lumped into with the other organizations. So I wanted to give you some pictures of my residents, because as we talk about all the negativity, of course, we love what we do, and we greatly enhance these folks' lives. And so obviously there's a good reason why we do it. So we got to protect them while we protect our own assets. And so we do that by documenting. So we document. You know, in real estate, they have the location. We have document. And we do that to prevent and protect. So the 5 pillars of risk management that we believe are important are, of course, insurance, ongoing and thorough maintenance plan, ongoing and thorough HR plan, thorough policies and procedures, and the bottom line is that documentation is a part of each of these pillars. So it may not be the 5th pillar, maybe it's just a part of each, but either way, it's a really important part. So when it comes to insurance, my example here for you guys, when I had to rely on my insurance, is a flood in my facility. I had a Alzheimer's licensed home. We had to move 10 residents out for 2.5 weeks. And as you can see on the pictures, had a lot of work to do. It was a pipe that burst, and we had to deal with that. And I tell you, there was about a week there. I did not think that my insurance would pay. But then Dave, who's on this call with us, stepped in, as he was my agent at the time as well. And then things started to move forward from there. So, you know, it's important that you pick insurance, of course, so you get the right coverage, but it also makes a difference if you have the right agent, for sure. So as far as maintenance goes, I would say this is another one of those simpler steps in your risk management tools and arsenal, is just have a good maintenance plan. You should have a monthly checklist. You fix the issues you find, and this should not cause a lot of stress. You can hire a handyman to do that, or if you have a good-looking husband like I do right there, then you're good to go. So that's just kidding, but that's my husband right there. So at any rate, it's really important that the facilities part is well kept, so that no one can, you know, show any sort of negligence on your part when it comes to that. Now we're getting into the more difficult part of risk management, is of course the HR portion, the staffing. You know, the National Center for Assisted Living, Lindsay Schwartz is the Associate Vice President of Workforce Quality Improvement. I listened to a speech of hers not so long ago, and she stated that in one of her presentations that our greatest challenge in the next 20 years is to find quality staff, and the only way to make it is to use technology. And I don't know about you guys, I find this to be extremely true. I do have turnover. I think that I pay my staff well, I love them, I care for them, and yet I think there's always some issues with the caregivers. So ongoing training and a really good plan is clearly important. Of course, a plan for everything means that you have really great policies and procedures. And I just wanted to share a short story with you guys about Betty. Betty was one of my residents, and here's a picture of a model that kind of looks like Betty. It's actually a very similar lady. She would sleep through the night, and I had a new caregiver who worked part-time, and one night Betty wakes up and the caregiver comes in and Betty tells her, I need to go to the bathroom. And so the caregiver looks at her and she's very excited and preppy and says, all right, Betty, how do we do that? And so Betty says, well, they take me to the bathroom and I go into the toilet. So my caregiver does that. She transfers her into the wheelchair, rolls her into the bathroom, rolls her back into the bedroom. And now at this point, she transferred her 3 times and it went flawlessly. And now the 4th time, that is, when she needs to be transferred back into the bed, Betty cannot go. She cannot anymore help her, and she has no more any use of her legs. And it turns out that reality hit in, which is that Betty hasn't used her legs in 7 years at that point. And somehow in the middle of the night, the way she thought of herself was like this middle lady. She felt a little younger and she somehow had use of her legs. Long story short, it was a very difficult transfer to put her back into bed, and she does have a knee fracture, or I'm sorry, a hairline fracture in her knee, and she ends up going in the hospital. So we can talk more about that later if you want to know what happened later, but I'm using this story as a way to indicate or to showcase for you how important it is to follow the care plan. So I have missed the opportunity and making sure that my caregiver knew that Betty had to be transferred into a Hoyer lift, and actually in the middle of the night she would have just been probably changed in bed if she needed to use the bathroom. But that's a really important example of following the care plan. So I'm going to hand it over to Dave now for his slides. So Molly, if you can toss the ball on to Dave.
Yes, Dave, I hope you're ready because here it comes.
I'm ready, I believe. Show my screen. So do you guys see my screen?
Yes, we're on your dashboard now, so you can go to the PowerPoint at the bottom. There you go.
Do you see the higher risk residence screen?
Not quite yet. You'll have to open the PowerPoint.
Oh, thank you. I thought I had it open. Is that it?
But you can go up to display settings up at the top and turn it into, up in the left-hand side, there's display settings.
Yes.
There you go. And then swap presenter view and slideshow, and then it'll be ready. Perfect.
Perfect. All right. Thanks for your patience on that, folks. So I'm not here to sell insurance. What I'm here to share with you is some of the learning experiences of our customers. Excuse me. And it often occurred to me that when I started specializing in insuring senior living, I just found a lot of owners were so focused on care, they didn't really know what might be coming down the road. So I developed a knowledge base of the top 10 reasons for having lawsuits. And I've turned that into this course, and we'll talk about ways to reduce the cost of insurance by reducing or mitigating your exposure to loss. Wouldn't that be nice? Instead of just having to take increased premiums or lawsuits and deal with them, why not turn it into a proactive approach? So that's what we do for our clients. And there's a lot of ways to do that. One of them is, we become a certified instructor to share what other people are doing. And Dora has talked about the possibility of lawsuits and things that can happen. Most people believe they'll never have a lawsuit. And you know what? You're right. But I can tell you this, in the last 3 years, we've had 13 wrongful death lawsuits in the 17 states we do business in, and that's a higher number than the previous 10 years put together. So it's a changing environment. So let's focus in a little bit on what we've seen and how we can develop some proactive tools. So how do we end up with higher risk residents? Well, as you know better than me, when that resident is assessed and you develop a care plan, they come into the facility, it changes over time. In fact, many people are not going to go home, right? And so the real issue is having care staff and managers, supervisors that are in touch with their caregivers and make sure that they're doing the documentation or the work that's important. We're going to talk about home health and hospice providers as, you know, they're great, but we're also going to talk to them about how they can increase your risk. 7 out of the 13 lawsuits involved home health or hospice. And guess what? Both organizations, the owner of the facility and hospice and home health, gets sued. We'll talk more about how that we can be a little proactive on that. But over time, as you know, change of condition happens and transfers don't become timely enough and in order to reduce the risk. And when that condition changes or increases to the point of higher risk, you know, I would suggest you want to communicate that and do something about it as soon as possible. Now, many people ask me, is COVID related allegations covered by insurance today? There's two issues. One is liability and one is workers' comp. And I can tell you that almost all liability policies exclude it, or they don't say anything about it, which means you don't know whether or not the claim will be honored. And so you just talk to your agent, open a claim if you have one. This would be a liability claim, would be a situation where the family has an accusation against you for not providing a safe environment for the loved one due to COVID. So it could be you didn't test properly, or maybe you allowed a visitor and you should not have, or you didn't test or provide PPP for your caregivers. That would be a liability type claim where you've endangered the resident. A workers' comp claim, on the other hand, would be where a caregiver accuses you of not providing a safe environment. And most workers' comp policies will cover it, but again, you don't know until you file a claim. So that's kind of the COVID situation. We're going to talk about caregiver training tools, defensibility, hospice, and home health in the time we have here today. But the goal is to reduce the cost of insurance, not only for you, but for everybody else. When an insurance company determines the rate, and by the way, no agent can ever determine the rate, it's always done by the insurance company based upon the documentation the agent presents on your behalf. The insurance company looks at not only the country, but then the state, then your zip code, and then your facility. So that in a very real sense, we're all in this together. Because if somebody has $1 million lawsuit across town, it's going to affect your premium, even if you have a perfect survey, perfect plan of correction. Excuse me. So I commend you for taking the time to learn more about how you can manage your business in a safe and proactive way. It's very important for everybody. So what happens nationwide statistically when there's a claim? I would update this. 34% of claims are settled out of court. It's currently running about 70%. Average cost to defend, $55,000. Average cost nationwide is $275,000. The real pain is it takes 29 months of back and forth and uncertainty before it gets closed. Why does it take so long? Well, the attorneys for the insurance company and attorneys for your family are posturing, trying to get the most without going to court. Neither party wants to go to court, so they'll write a check. And on average, you can see in 5 or 6 states, the average is really 400,000. And I would say in the West Coast, it's more like 500,000. So if it's an elder abuse accusation, which, you know, if you have a broken fingernail, they're gonna allege that you had elder abuse. Elder abuse claims can also come with double or treble damages. So what you want to watch for and check for in your policies to make sure elder abuse and sexual abuse molestation, what's your one combined coverage point, is at least 500,000. I see a lot of policies out there where it's 100,000 or 250,000, and you save $500 or $600 in premium because the insurance company really doesn't want to cover you for $1 million because they know the numbers and they'll use it against you if you end up having that type of claim. And like I said, almost all of them have it. So here's the top 10 list. Number 1 being skin breakdown, pressure ulcer. And in most cases, you know, the family's going to retain hospice or home health. Well, but guess what? You still have a resident agreement. You're responsible for change of condition, notification, and documentation, because most folks that I know of don't hire Hospice 724. Resident falls, we're going to talk more about that. Failure to follow physician orders, changing condition, and assessments we'll talk about. Elopements doesn't happen very often, but when it does, it's not pretty. As I said, abuse and molestation is not as frequent as far as actual settlement, but it's the largest, and it normally is involved with every accusation. So what we're going to talk about, and I don't think we'll have the time to go through all the forms we have, but we have some proactive tools for falls assessment, skin condition monitoring, and coordinated care with hospice and home health. And of course, Dora will talk more about documentation best practices, and we can get software. There's 2 insurance companies will give you a discount if you're using a software program to document or make your care plans paperless, because they know a paperless digital care plan is better defensibility and ends up having a lower claim settlement, because now when the insurance company attorney comes in to work on defending you, you've got good documentation. So there's at least 2 companies out there will give you a discount for that we work with, and you know, other agents may as well. Effective communications. I would suggest one of the proactive ways also is when at the time of admittance, you might consider doing a YouTube video of the end of life process. Most families have no idea what it's all about and what they're going to go through and what you're going to do for them. And I think by introducing the topic, you set the stage for conversation and what you're going to do for them. And it's going to be challenging for all parties concerned. So the falls the falls assessment document focuses on mobility, stability, hesitation, ambulatory, and then there's medication impact on falls. And we would suggest you have a conversation with your caregivers in a monthly meeting about fall prevention. And in the conversation, ask them what do they think in the facility would be the top 3 events associated with falls? What causes them? When someone comes into the facility for the first time, Do we make sure that they have a call light or water and tissues handy so that when they wake up at night, uh, you know, in a strange environment, they don't have to go searching for these things? And the last item, what the insurance industry has found is that when 4 or more psychotropic drugs are prescribed, the risk of fall goes through the roof. So your proactive measure would be if someone's on 3 meds and the doctor prescribes a 4th one, everybody in your facility should know that resident just became very high risk. And we've also run into a situation where people are not using Hoyer lifts or 2-person transfers. And of course, in many boarding cares, it's very hard to have 2 people on duty in 2nd or 3rd shift. So a Hoyer lift is needed. I can tell you that one of our largest lawsuit settlements was where the owner, very experienced owner, 20 years of experience, 3 facilities, and he told the family he could not manage their mother because she was very heavy and she was virtually immobile, and the family pleaded with him to not transfer out because they couldn't afford a skilled nursing facility. Some weeks later, in fact, the mother did develop a bed sore, and of course they called 911 and she expired at another facility. This owner thought he was doing the family a favor. A year later, they sued him. We settled out of court for $425,000 because they couldn't handle him and they didn't have a Hoyer lift. We also suggest another thing you might do with your staff is to do a visual impairment risk where you take some glasses and fog them up, then ask your caregivers to walk around the room and kind of get an appreciation for what some residents are seeing and looking at. Another thing we can talk about, another technology, is called the Safely You Falls technology. And in the interest of time, I won't go into that, but basically it's a camera technology that analyzes falls, and it's approved by most states and lawyers from a privacy point of view. It's not an issue, and families love it. And Emeritus, as an example, has standardized it on this technology in all of their facilities. And there's one insurance company I know gives a major discount if you have this technology installed. Skin condition monitoring. So you know better than me that skin breakdown can happen quite quickly, and we recommend that what you do is you train caregivers on what the various what the 4 stages of skin condition look like, and we have a handout available. I think what we'll talk about, Molly, is getting you copies of the handouts, and maybe you can distribute them to everybody in email. But we have a training aid that you can use in your monthly meeting with caregivers so that they recognize the various skin conditions and what they can do about it and how they can update their assessment and document it. And then, obviously if it gets beyond stage 3, most facilities are not licensed to do that, and we have to get either transfer or get home health involved. So recognizing that change of condition we found is really important. Hospice and home health. When they are involved, you're still liable. Like I said, you still have a resident agreement. And we have a form, a handout we'll send to you that it's a 1-page form. It's kind of summarizes the care plan agreement you have with hospice and home health, but it's a checklist. So on one piece of paper, you can document your conference with the representative from hospice or home health, and then your caregivers know what they need to watch for and how they need to follow up on change of condition. So kind of summarizing, we really highly recommend the monthly conversation, even if it's repetitive. It bears repeating in most cases. And of course, in your documentation, it's really important, I think, that if the first shift knows that someone's become a higher risk resident, we add them to the list and make sure your other shifts know that that this person is higher risk, and post it. Obviously, there's a privacy issue, but we want to track these higher risk residents and post it where the caregivers can see it, and you can discuss it in your monthly meeting or in your staff turnover or your shift turnover conversations. We also recommend an arbitration clause in your resident agreement. Our clients get one for their resident agreement, and it's not binding arbitration. It just says that the family understands that before you go to litigation, if you have an issue, we're going to sit down and arbitrate it, and I have at least 2 insurance companies will give you a discount for this, because they know that when the family hears about what you've done for their loved one, that attorney who's whispering in their ear saying they're going to get them a big settlement kind of changes the tune. Also, if you have ambulance chasing attorney involved with a lawsuit that's frivolous, which about half of them are, by the way, they may take a case on retainer, meaning they'll want 40% of the settlement, but they get no fees up front. When they see an arbitration clause, they disappear into the woods and they look for those other situations where there isn't an arbitration clause, because an arbitration clause means it's going to take too long for them to get their money. Most attorneys are against arbitration clauses. Well, many. Depends on whether a defense attorney or a prosecuting attorney. A defense attorney loves them. Prosecuting attorney says they won't hold up. Well, ours will hold up. Another area of risk that I just want to touch on is if you have a board and care, it's a residential property. Many people have a homeowner's policy for fire hazard. And the insurance world says if you have more than 4 renters, it's a commercial property, you need commercial property insurance. What does that mean? That means it's a different policy, costs a little bit more money, but it'll cover your business because you have a business license and a business relationship going on. A homeowner's policy from, Farmers or Allstate or Nationwide or any of the other homeowners policies, if you read back to like page 68 of a 78-page policy, it's going to tell you that you're required to notify them of a change of operations in the facility, meaning if the house burns down, they're not going to rebuild it. They'll use that clause against you, and your money is wasted, even though they issue a policy. So that's something you want to talk to your agent about, because one of the major assets in your business is really your real estate. You want to make sure it's properly covered. I'll touch briefly on documentation, and Dora's going to be focusing on it a little bit more. Again, you want to document just the facts and avoid abbreviations. And like I said, some insurance companies will give you a discount for using software documentation. So in summary, my message is be proactive instead of reactive, learn from others, and have those monthly safety meetings, and look for those caregivers who have the same commitment to level of care that you have. And if they don't, it may be time to help a caregiver find another career. So if there's anything else, I think, Dora, we're going to throw it back to you.
All right, Dora, are you ready?
I'm ready.
All right, back to
Okay.
Dora.
Show my screen. So you guys, I jumped back to the beginning. I was ready to go anyway. Okay. Molly, you see documentation must not take time from person-centered care?
Yes, you're there.
Okay, great. So thank you, Dave. That was an awesome, awesome information on all the different risks and some really great suggestions for us. So as far as documentations go, I have been documenting for a long time, and when I started out in the residential assisted living world, I was on paper form, and eventually, soon after, I switched to a digital method, and then later on, I developed Docuwizz. So I'm going to show you guys some of the benefits of the digital world. And part of it is that we're in this world anyway. These are kind of like the hands of your caregivers.
Hey, Dora, I think we just lost you as far as audio. Can anyone else hear me that they can't hear Dora?
Right, I can hear you, but I can't hear Dora.
Yep. Dora, we lost you for a second. I do see your audio on. I'm not sure why we lost you. Yep, and everyone else is saying the same thing. They can't hear Dora, but they can hear us. So Dora, if you can hear us, flip back and forth between slides really quick. I don't even know if Dora can hear.
Yeah, she may have lost internet. I muted my microphone, and that was at the same time we lost her audio. I thought maybe it was something I did, but I don't think so.
Dave, can you give her a call really quick, just in case, just so we know what's going on with her?
Good point. I sure will. Let me grab my cell phone.
Thanks, guys. All right, so everyone, you guys have great questions. As soon as Dave's back, I will ask a couple of these questions that are related to Dave, and then we'll wait for,
Okay.
There you go, Dora's back. Perfect.
Sorry, I lost network connection for a second, but I think I'm back.
Oh, okay, good. There we go.
Okay, sorry about that. So you guys see my slides still?
Yeah, so you were on the hands. You were saying these hands were like the hands of your caregivers.
Okay,
Yeah, right
perfect.
there.
Okay,
We got it.
Okay. All right. So the next slide is about this idea of digital versus paper documentation, and I've chosen this kind of old-fashioned, kind of long incident report as our background. I'm sure you've seen something like it, if not exactly it. But when I was doing these kind of incident reports, I would get like 10 a year, because there's 10 maybe kind of major, bigger incidents that happen in about 10-bed facility. And then when we switched to digital documentation, we basically were getting like thousands of documentations per year. So like it greatly increased. And if you are on paper right now, you might think, I don't want to have 1,000 documentations, but obviously a lot of those were short notes and just not necessarily what I would call an incident report, but it was a chart note or some sort of a note that was important to keep in that resident's file, but not necessarily, elevated to the resident incident/accident report system. So, we document because it's the right thing to do, and also because we want to have proof of, well, service rendered, of what happened, and because we want to pass responsibility on to others as well, and also because it's required in some instances. So depending on your regulations, it might be required. So in my homes, we document a lot of things, which is why I'm a proponent of finding the right digital method, something that keeps you organized and in compliance. So here are some of the logs that we have in our homes, from ADL logs to medications received, destroyed, obviously the MARS, chart notes, incident reports, brief change, intake, activities log, visitors logs, all kinds of stuff. So we document these things so that we have proof of service provided. But doing this kind of in paper, it makes you be kind of overwhelmed with everything. And I know at the beginning there were all kinds of binders. My caregivers had to be trained on which one to reach for when. And so there's a better way. And the better way is digital. So if you have digital documentation, then you can track the near miss or the small things, and which helps you track due dates, incidents and tasks. It helps you track care changes, and it hopefully will provide you with data metrics. And you can see how well your staff pays attention, and you can do all that remotely. So even if you're not at your facility, you're able to make sure that they're doing the right documentation. So I definitely think there's a lot of advantages to it. But before we go more into it, one of the questions I get a lot is it allowed? Is it allowed to have digital documentation? And so I think nowadays, especially in this COVID environment, sort of the digital world has even more expanded than it had been. But as long as you're able to print a PDF, provide a PDF either on a digital screen or actually print something out within 15 minutes of the document being requested, then it is equal to a hard copy. This is a federal standard. So obviously you'd want to have a system that allows you to print things out so that way you can have that hard copy if it was needed. Now, you may need to log in and show your files on a computer printout, on a computer screen, when your surveyors come, or you can print it out for them. Now, CMS, that's the Center for Medicare and Medicaid Services, is not something that we deal with often because we're non-medical, most of us, but our counterparts are the nursing homes, hospitals, so others in the long-term care continuum respond and have to do what CMS says, and CMS doesn't just allow it, it requires it. So whether or not it's required, it's not even a question if it's required or if it's allowed. It's really a question of will it be ever required, and I think that it might be in the future. So it's definitely a good time to start looking into digital documentation systems. When you need to have, what you need to have though is a system that is HIPAA compliant and that is secure. And so when we do the paper forms and we have an initial on those paper forms, that's our identity. And so in the digital world, we have to have a system where we can log in with a secure password, and our login is our identity. So our initials go onto these logs by the fact that we logged into the system. So it's important that you have that, and you don't have to do both paper and digital. For a transition period of a week or two, maybe a month, you might be able to might be doing both until everyone is switched over to the digital. But the idea is to reduce workload by using the digital system. So so the biggest question is, how do we get the staff to do it? How do we get them to document, period? Whether it's you're in a situation where you want them to document more than what they're doing now, or and you're still on paper, or you are ready to switch from paper to digital. The point is that change is hard, and you have to get your staff to understand why you're trying to get them to change and what you're trying to accomplish with it. So you have to support them, and you have to hold them accountable to whatever systems that you're putting forth. And as you're making these changes, and as you're trying to do a better job at documenting and supporting some of the ideas that Dave shared with you, remember this phases of skill and the change in individual. This was actually from a presentation at NCAL, but this is a common kind of list, and it starts with the unconsciously unskilled. So when you first hire a caregiver, they're not gonna know what questions to ask, and they won't know what to do. And that's your unconsciously unskilled. Then eventually they'll get to a point where they know what to ask, and they're still unskilled though. And then they'll be consciously skilled. That's when they know what to do. They can go ahead and do it. But the problem is eventually we all get to the unconsciously skilled kind of stage, and that's where we're kind of robots and we just know what to do, and we keep doing the same thing over and over again. And this unconsciously skilled level is when it becomes hard to respond to the changing conditions, when you've always done one thing to this client and that client actually wants it done that way, but the family, the doctors, your experience tells you that you now have to do it differently. You now have to do it more often, or or not one person to help, but two people to help. So when those changes occur, it's hard to get people to recognize that and to change that. And the digital systems should help with that. So you got to support, you got to coach them, and you got to support them, but ultimately you have to hold them accountable to your expectations. So sometimes I have care homeowners that are telling me that, oh no, my staff won't do that. And I kind of say to that, look, your staff will do what you expect them to do. And if this is important to you, then they will do it. Certainly my staff has done it for many, many years. And there are harder and simpler systems out there. I had a hard system at first, and they even did that. And of course, now I'm promoting a much simpler system that any caregiver can do, because there's no free flow typing involved. There's a wizard that's created for them to help with the documentation. So ultimately, obviously, they're never going to think twice about feeding your residents. That's kind of given, right? And I'm not saying that meal preparation and meal serving is at the same level as documentation, but if documentation is important, then you're going to make sure that they do it. So when it comes to documentation, let's say that you've gone through the process, you've supported them, you coached them, and now they are doing it, they're documenting. So now what? So now you have to share them, right? So simply having the documentation in place is not enough. You have to pass on the information to the proper parties. So sometimes it's the doctor, sometimes it's the family member, sometimes it's the nurse. So you got to share this information with the right people. So when you have, a digital system, you can pull down blood sugar counts, you can print an incident report, obviously a MAR. You can look at things in a mobile format as you're on the go, so you can read what's happened to somebody and share some of these things. Obviously, metrics are helpful. So when you're able to pull metrics, it really helps in seeing some of the situations you've dealt with. And if for nothing else, you can use it for marketing. You've reduced the number of falls by this percentage, or you have 0 XYZ incident. And those things should help you in marketing wise, but as well as for your risk management. So just a few notes about documentation. In my experience, about 50% of documentation is in my vault, so it's not something I ever have to print out. There's a ton of stuff. My caregivers document visitors, obviously temperatures nowadays, whether or not we have symptoms of respiratory distress. But 50% of those just kind of sits in my vault for the hopefully never needing to give it to an attorney. And then 45% of it about goes to the PCP, to the family. I'm sharing it, I want to keep them up to date. I want to keep them involved and knowing the aging process, knowing that their loved one is getting weaker or is becoming a greater fall risk. So I want to keep them up to speed on what's going on. And hopefully 0 to 5% is the amount of documentations that you have to provide and show it to some sort of authority. So hopefully that never happens to you, but say adult, some sort of adult protective services that's coming to you, or an attorney or something like that. So I wanted to just share a few examples of incidents that have happened while I've been doing this line of work. So these are real residents and real stories. So if you don't mind me sharing a few of them with you and learn from my experience. So I've had a resident who was a exit-seeking advanced dementia type resident who was very agitated and very aggressively needing to leave the facility, and she wanted to walk to New York. And I'm based in Las Vegas, so you can see the issue there. So her family was in the East Coast, never came to my home. We've admitted her through virtual methods, and every time she was agitated and aggressive, we would report it to the doctor. The doctor would change her medications. Then she would become too lethargic and she would be at a fall risk. And that kind of went up and down a couple of times. And she ended up in the hospital with falls about 2 or 3 times before she wasn't returned to us. So either the daughter or somebody decided not to have her come back to our home. And a couple of days or weeks later, we had a knock on our door, and it was our adult care protective services that were knocking. So apparently someone in the hospital or the daughter herself, we don't know, had reported us for potentially neglecting this lady. But when they came, we were able to print out an aggregate list of documentation which showed dates and time, the types of behaviors that we had, obviously what the narrative of what the situation was. It showed some follow-up notes of what we've done to respond to some of these situations. And this was many pages. And after that, they just walked away. So in this case, this is a great use of a digital documentation, because we're quickly able to kind of pull up what happened in the last 6 months that she lived with us. Another quick example is an Alzheimer's lady that lived with us for almost 6 months, and she was a very difficult client. But the situation with her is that her appetite started to reduce, and we've reported that to the family, to the doctors. We've done all kinds of extra things to try to get more food in her. She started to lose weight, and so the son started to blame us for not feeding her. And so when that happened, we amped up our documentation. We took pictures of her eating, the foods that we were serving her, the plates, and everything. We were taking care of that. And unfortunately, after she moved out, protective services came again, and we were able to give this documentation similar to what you saw before, just an aggregate list of what happened and what we've done and how we responded to things. This is actually a real picture, so I'm going to switch off of it real quick so I don't break any HIPAA laws, but you can see the point of being able to prove that we've done what we could to help this lady. Another quick story is a fall risk resident. So Elsie was one of my residents, and we had 6 pages of what you see here of incidents with her. And she was a super independent lady. She lived by herself for like 90 years. Well, as she was in her 90s, so obviously she lived by herself for a long time. And she just did not want us to help her, but she was not physically at the place where she could do some of these things by herself. So a long story short, we tried to get her to exercise. We made sure she had the right footwear. But to prevent falls, you have to be able to prevent fainting. You have to be able to, make sure that her motor skills are still intact in the right place, and they weren't. So I had a meeting with the family. I showed them all these incidents, and we then signed a negotiated risk agreement where the family said, yes, we know she might fall, but we don't want her to have the kind of life where somebody has eyes on her 24/7. So it's not the kind of life she would want. So they just accepted the risk on some level of her falling. So this is another kind of great way to use your digital documentation. So I'm going to skip this last scenario that I had, but the long story short on that is that I was fined. I had a fine, even though we did everything we could to take care of this wound on this resident on his heel. Unfortunately, he, we think it was a home health agency that came, that reported us, and we had no documentation or proof of the fact that we did turn him in the middle of the night. And so I was fined. So in this case, there was no lawsuit. The family loved us and knew that we were doing our best, but protective services came anyway. So the future of care is to include technology to reduce caregiver workload and increase productivity, technology to be simple enough for all staffing levels, to be cloud-based and secure, to provide metrics to guide us and to prove our worth. And so I hope that after this session, I've convinced you to consider digital documentation and that you visit me at Docuwizz. So my email is dora@docuwizz.com. This is a sort of a mobile view of a Docuwizz dashboard. Docuwizz will provide you with a touch tap wizard that where the caregivers just tap through on their mobile device or on a tablet you provide, where the wizard puts together the narratives for them, so it becomes objective and it almost reminds them of what to do in a certain situation. It provides you with an e-tasking method, so all of their tasks and all of their to-dos is in one long list. And so in other words, when something changes and you update the e-tasks, then you don't have to have a staff meeting every time or reach out to every shift. You know, they should be looking at their tasks and notice the change. So, so it's a really good way to do that. We have a secure messaging platform, a small CRM, an optional EMR, and a custom due dates tracker, and a lot more. So I hope that you come and visit me at Docuwizz.com. If you go to demo on our website, you will see a link to schedule an appointment with me for a one-on-one demo or to join me at one of my public demos. And also there's a couple of videos there I would invite you to come and take a look at. And of course you can email and call me, and would love to talk to you more about what Docuwizz can do for you and how it can make your lives easier. And of course, Docuwizz is one of those rare softwares where our pricing is transparent. It's right on our website. You'll be able to check that out, as opposed to a lot of these softwares require a demo before they even tell you how much they want to charge you. So give us a shot, and I'd love to talk to you. So that gives me just about a few minutes at the end here to see if there's any questions or anything we could address for you.
And there is a few questions, Dora. And before I get to the questions, I just want to show you guys, Dora has been through all of these things, right? And she still talks about this with so much love. And she talks about her residents and her residents' families that love her. I love that last story where you said, the family knew we were taking care of them. So even though some of these situations you won't be able to avoid, and I think you guys should all know that, right? If you have a good relationship with that family and you're making documentation of everything, there is absolutely no reason this should be a worry for you, right? So these things happen. People, the elderly have conditions that happen and there's no avoiding them, obviously. And Dora is still in this industry, still doing this, owning a home herself and doing this day to day, yet she can sit here and talk about these things that she's experienced with a smile on her face. So I think this is really, really great. And it's good for you guys to see somebody else who's going through these things. Many of you are in the process of starting right now. So I will get into these questions. Let's start from the top. In the beginning,
thank you, Molly. I mean, definitely, this is not meant to scare you. If you're still considering this industry, it's a wonderful place to be. It is a business that, like Jean says, you can do well and you can do good. Absolutely, you just got to do it right, and that's what we are here to help you do.
Absolutely, for sure. And Dora's a great resource for that. So in the beginning of your presentation, you talked about your flood, and someone wants to know, where did your residents stay for those 2 weeks?
Right. So luck would have it, there was another facility that just got licensed like that week and was empty. And we rented their facility for that 2.5 weeks. But there had been others in my area that I know that had similar situations, and they would rent out hotel rooms and move everyone over with the caregivers and bring in food and all of that. So yeah, it's very difficult. I had a better situation because we got to be in a home and we were still together with the regular caregivers and everything.
How lucky. And then Dave, actually, someone has a question. Do you insure in Virginia?
Yes, we do.
All right.
We can insure in all of the lower 48 states.
Perfect. And then another question for Dave. It says, do you recommend a special presentation or a unique wording to give the family at the beginning that may hopefully reduce the chance of lawsuit later? For example, seniors do sometimes fall, but our facility and staff are up to code and qualified to, as much as possible, prevent this.
Well, I'm not sure I know the best words for that. I mean, a lawyer can give you something too, but I think an experienced owner can share good introductory conversation. And one of the things you would really want to consider too at some point in the initial interview is to make sure you understand why they're coming to your facility. We've had a couple of situations where people are actually lawsuit shopping. And we had one in New Mexico where this was the third lawsuit in about 3 years. And we ended up going to court on that and we won. And the judge threw it out and said, and admonished the attorney for bringing the case to court, should never have come to court. But you know what? It costs $150,000 in legal fees. And another thing so you really want to know why someone's coming in your facility, and also consider what's called a negotiated risk agreement. Dora touched on that. A negotiated risk agreement defines a higher risk situation for a resident. And it can be part of your initial interview, or it can be later on when you do a reassessment. And it just says that, it's a one-pager, says that this is the situation and you're going to waive me of liability. Now, they can still sue you, but it forces the conversation. And if someone doesn't sign it, you may ask yourself why I'm going to admit this loved one.
I want to add on to that a little bit. I think that so many times people come to us and say, okay, here's what's wrong with my loved one, or what care they need, and I explain to them, I understand that, but we are not a one-on-one care. We provide group care, so we can't have eyes on your loved one 24/7. So if you want to make sure they don't fall, then you need to hire 24/7 awake staffing at their site all the time, depending on the person, obviously. So when they realize how much that is, and they realize that they can't afford that, then it sort of forces that, like Dave said, that conversation about what to do. And so there are assessment forms that we have the families fill out so that they recognize how much thinking goes into of what we do. And we'd be happy to share those forms with you guys. And Providers Web has them, so there's a lot of sources for those.
Perfect. So it's great. Dora is a great resource for you guys in many ways. Absolutely. So is there an easy tutorial for ESL caregivers?
Easy tutorial for what?
ESL. So I'm assuming different
English
languages.
is a second language?
English is a second language.
Oh, wow. Don't know.
I don't know. In the
Docuwizz.
state of Nevada, we're regulated and there's a regulation that says they have to be able to speak enough English. So we don't even do anything in another language because they are required to speak.
Yeah.
So I don't know.
But your program would work for other than Nevada, correct? Your program would
Right. So the
cover
program, what's cool about it is the wizard kind of just makes them answer questions and pick categories. And as the categories are picked, the narrative is put together, the sentence is put together. They don't, like, even myself being Hungarian, I sometimes mess up he and she because we don't have that in my language. So, and many Filipinos do the same thing. Sometimes when I was reading like a free flow, like documentation from my Filipino caregivers, it was like he said and then she blah blah. I'm like, wait, what are you talking about? So our wizard takes care of that. So but as far as like a tutorial for your non-English speaking caregivers, I'm not familiar with that.
Dora, this is Dave, and I would like to emphasize that because I know you're, in the interest of time, you're going a little quickly, but the wizard is phenomenal. So what people need to understand is when a caregiver or administrator clicks on a checkbox that they did something, though there's going to be a sentence automatically created, right, Dora?
Yes, you're right.
Into the care plan,
yeah.
And you can edit
well,
it, right?
into the incident report.
The incident
Into the
report.
documentation.
Sorry, into the incident report. So you get a standardized description of that activity, and that those words are designed from a owner's point of view and experience, so that it'll be properly documented to keep you out of trouble.
Right.
So that people
Thank
can't, and if you look at it from a negative point of view, people can't say the wrong thing, right, Dora?
Right, right. They
You can just add to it, right? Yeah. And so I think exactly what you're saying is that it's pretty self-sufficient, like Dora had said earlier. Once someone falls, for example, it has a fall in there. So you go to fall and then you click on fall and it has all of the processes afterwards. It wants to ask you each question and the sequence of questions that you need to answer based off of what documentation somebody would be looking for, whether it's from the state, whether it's from protective services, whatever information they would want to know on how you responded, how quickly you responded, and when you responded. It would all ask you those questions with pre-written sentences in there that you could add to from there. So if someone doesn't
Yes.
speak English, it would be easy enough to teach them, here it's going to show you
Yes, you
these
can
things
always
that
add
you
at the
do. If
end.
you write in English, then you can write these things in
That-
English. Yeah.
And another thing that goes along with that, if I might, Dora, maybe you could speak to what an owner or an administrator can do remotely to check up on what's going on in a incident report.
You know, I think she might be frozen real quick, but there is some more questions for you real quick, Dave.
She is
There-
frozen, yeah. Go
Yeah,
ahead.
so we'll let her come back. But how would you know if a family is potentially sue happy when they're looking for a facility? And so you're basically saying if you have this negotiated risk agreement, if they don't sign that, that might be a sign that someone's sue happy. You can also look people up and see what litigations they've been in the process of. So if you feel like that something's off, it's public knowledge when someone has done those things in the past. So, you know, there's
Good
probably a
point.
couple of ways. Yeah.
Yeah, I think what it's obviously very difficult, but you know what? After you talk to X number of families, you could tell when someone's not exactly right. Just use your business sense, and if that doesn't seem right, you might defer, give them a reason to not complete the admission process. You need to check this or do that, check availability, training, or what have you. And then, like you say, go to the internet and Google their name and find out. Or if they tell you they were at XYZ facility, call that facility owner and ask them about these people.
Absolutely, absolutely. It's just the same. So I will say I used to own an automotive business, and many times you'll get somebody that's pulling their car from a different mechanic shop, and you always wonder, right? And this is a
Yep.
totally different scenario, and I hope this doesn't sound, you know, ignorant, but it you know, if they bring it over to you, you wonder why'd you leave the other shop? Just like if somebody comes to you from another assisted living facility, you wonder why they left that place. And so of course you can ask them, but it is good to also ask whoever they came from, because they may be able to tell you something about that resident that you didn't know from the interview with them. So that's important too. Dave,
It
who
is to
signs
know the
that?
positive and the negative. You're right.
Yeah, who signs that negotiated risk agreement? It's the family, correct?
Sorry? Oh, yeah,
Yeah,
the power of
it's the
attorney, the
family.
POA.
Yeah, that's what I thought as well.
Yep.
So, go ahead, Dave.
I was just going to say, Dora, now that you're back, I was asking a question. I thought it would be helpful for the audience to understand what an administrator or owner can see that's going on with an incident report from their remote device.
So basically, it's a module where you read all the different incidents that have occurred, and they have the ability to sort of use it and like a little checkbox. Yes, I've read this. I'm done with that one, and then you always know which one you still have outstanding. And there's a place where you could add your own notes, and that becomes part of the record. So when you follow up, then you add your own notes. Somebody went to the hospital, then you right there, right in the hospital, you can say, I'm right here, I'm talking to so-and-so nurse, they received the med list or whatever it is that I brought. So you can add that to the documentation that the caregivers submitted already about so-and-so going to the hospital. So it's a really dynamic system for even the owners to continue to manage the documentations.
It's really important, and you can see why insurance companies would give you a discount. I actually have a lawsuit that was reported about 6 months ago where the owner was cited for and the family sued because the caregiver called the owner, who wasn't at the facility, and said, we need to transfer this person. The owner said, I want to do an in-person assessment before we do the transfer. He didn't get there till the end of the day. And by that time, the condition had worsened and became a real problem. The family was upset and sued, and he also got cited by licensing for not transferring in a timely manner. Had he had software, he could have checked and figured out what was going on and maybe made some sort of assessment or comment before he even got there.
And then being able to attach pictures, you know, obviously you don't want to have those hanging around, but I mean, in in Docuwizz, you can attach a picture of a skin tear, of the skin condition that's private, and it's a great way to know that, oh yes, this is something I need to drop everything for and go over there and make that decision, or okay, I can wait till the end of the day or tomorrow.
Perfect. And going back to that English as a second language caregiver, would either of you consider that as a higher risk for your facility if you have a caregiver that doesn't speak English?
I don't. I have a lot of caregivers that are born somewhere else that have, and a lot of times they're very loving and caring and provide excellent care. So I don't personally, and that's why I developed Docuwizz. Actually, that's the main reason, is because I've had caregivers that were really good at Docuwizz but weren't as great caregivers, and I had really great caregivers that just weren't good at documenting, and so Docuwizz really addresses that specifically. So I think with Docuwizz, it's a little less worry to have those caregivers that are less kind of skilled at putting narratives together, so you get the best of both worlds.
Yeah, absolutely. And to give them the dissertation or whatever you would say that they need to have afterwards, right? They need to be able to put those things together in the right manner, and you
Right.
let them do that. And someone asked, can you use Docuwizz for caregivers and residents? I'm not sure, Glenda, if you could clarify exactly what you would use it for caregivers, but what would you take that as, Dora?
I keep losing you guys. I don't know why.
I think Dora's just having some issues with her internet.
I heard you talking, Dora, but now you're frozen.
Yeah, she's frozen right at the moment. But Dave, can you give me your email address again? Someone's asking.
Sure.
I'm sorry, I don't know what's happening with my internet, but I lost you again.
We hear you okay
I
now.
hear you now.
Okay, so I know Glenn was asking about caregivers and residents, and so they both have profiles in Docuwizz. So you can track things for both caregivers and resident when it comes to things you need to track: TB tests, physicals, trainings. But the documentation specifically is about the resident, and then there is a small part within the user profile, so the caregiver's profile, where you can even document incidents that your staff cause: tardiness, non-compliance, etc.
And anyone that has extra questions, Nancy, those extra questions that you have for Dave, unrelated to this, I will send you guys his email address with the recording. So once I get you guys this recording out, I'll get you all the contact information for everyone. I'll also put the link for this. You guys could probably pop over to the demo website right here, docuwizz.com/demo. And Dora's email is easydora@docuwizz.com. So let's see, there's been a couple of others that have come in.
Did you get my email?
Yeah. Did you send me an email?
No, I didn't. It was on one of the slides, but it's dwurtzberger@sierraprofessional.com.
Because that's so easy, right? D
W-
WERTZBERGER.
Correct. At Sierra, SIERR professional.com. Dora just threw it up on the screen. Thank you, Dora.
Yeah, there it is.
Okay, perfect. So that answers, and if anybody has any other additional insurance questions, that answers those. But the next question that came up is the family able to see the notes that you take for your resident?
Not unless you share it with them.
Okay.
So it's only what you share.
It's not like a public platform that gets sent out like a notification of any kind, right?
Not at all. It's meant to protect us.
Perfect.
There are things you don't want to show anybody.
Well, and also it may be a good thing in the beginning that you show them that you have this documentation process, maybe that you show them that you have Docuwizz, because I can tell you once Dora goes through a demo with you, and you don't even have to have a person in there. It could be a fake profile in there that you just use to show people as a demo to say, hey, if there is ever anything, just so you know, we documentate everything. And then that way they know that you're already going to check those balances, right?
Yeah, and I mean, you're going to start sharing some of the documentations, and then they'll see the system. And there's obviously a face sheet and a, way to print things that show them that, oh yeah, this looks neat. So at least you can see the system.
Yeah, absolutely. Well, it doesn't look like I have had any other questions come in, but this was great. I mean, extremely informative. Like I said, I hope you guys recognize that Dora clearly loves what she does still, even though there is this part to it, right? And it's something that we have to talk about, the good, the bad, and the ugly to this. And so there are ways to handle this, and you guys will be able to do it as long as you have us, the association, in your hand, right? We have an amazing legal team. We have amazing vendors like Dora and Docuwizz. And then, of course, I'm so glad you brought Dave, because that added a whole new element to this. So Dave, you'll probably get some people reaching out to you since you're so experienced in this. And Dora, I hope that people are reaching out to you as well, because this is going to be so great for your guys' homes. Whether you're started now or you're in the process of getting started, I think this is really going to help you guys.
Absolutely. Thank you,
right,
Molly, for having us.
Thank you. Have a great
Thank
evening.
you.
Good
All
night,
right, have a great
everybody.
evening. Good night.
Good night.
Have a good